Nothing like a bonfire on a cold winter night, huh, doctors?
Ooh, nice white coat.
Thank you, I've always wanted one. What's the most memorable gift you've ever received, doctors?
Oh, when I was 12 years old, my mom gave me my very first stethoscope.
Well, last year I got a beekeeper suit.
I got real coal in my stocking once.
Oh, well, my best gift is being with you three brilliant-minded doctors.
Alexis, you deserve better than that.
Oh, well, maybe, but you know who else got a great gift this holiday season? The man you're about to meet, because Jim Wagner got the gift of life, a new heart. Enjoy this holiday encore presentation of All Things Heart.
I don't know what the protocol is in this day and age, but I don't assume they're transplanting a lot of 74-year-old people.
Looking at the person and not the age. When other doctors might have said he was too old, his doctor here at the health system said he was perfect for a new heart. His story coming up on today's All Things Heart.
From the University of Kansas Health System.
I am amazed. The team here is great.
I came on a Tuesday, and then by Saturday I had a heart in me.
I have never seen a group of people work together so good as this team of heart specialists. I mean, it's just unreal.
Stand by to set up show.
And the Dolph C. Simons Jr. Family Broadcast Studio.
Roll.
Always makes you feel like you're the most important patient on the planet.
I felt heard, and that was really big.
This is All Things Heart.
Good morning. It's Thursday, December 1st. I'm Alexis Del Cid. Welcome back to All Things Heart. And here's what we're talking about today. How old is too old for a heart transplant? We look at the guidelines and why doctors say this patient was the perfect exception. Plus, new hope for other patients over the age of 70 who are looking for a life-saving transplant. Our doctor weighs in on a recent study. And we take you behind the mask, how the doctor whose patients call a guardian angel spends his time outside of the hospital. And we love answering your questions. Your questions are the heartbeat of our show. So be sure to send them in on YouTube, Facebook, and the All Things Heart email. We have the links right here on your screen. Age can be a barrier when it comes to getting a transplant. Jim Wagner was over the age of 70 when he came to the University of Kansas Health System with limited options and a failing heart. He walked out with a new heart.
Jim, how are you?
I'm doing good, very good, thank you.
That's fantastic.
Fantastic is not the word Dr. Zubair Shah would have ever used to describe Jim Wagner in August of 2021. Not by a long shot.
When I saw the echo, my thought was, how is he still alive?
Let's be honest, how is he still alive is the last question you ever want your doctor asking about you. But here he was, with a heart apparently only functioning at 30%. His thickness in the heart so severe, the cavity size so small, Dr. Shah told them he'd never seen anything like it.
And so you're just like numb, frightened.
On top of that, Jim and his wife Marlene were stunned. They had only made the appointment and driven to the University of Kansas Health System from their home in Nebraska to meet Dr. Shah to simply make the case for getting into one of Dr. Shah's clinical trials.
Immediately when I saw the images, I said, Jim, let's not talk about trial. This is something more serious than trial.
And he basically told us that of 100 patients, I was the worst one he was treating at that time, and that my only hope would be a transplant.
A heart transplant, and Jim was about to turn 74. His age would typically be a big red flag for many doctors who would say his age automatically ruled him out as a candidate for a new heart.
Thank goodness Dr. Shah didn't look at my actual birth date. He looked at me as a person and didn't just look at my age.
Dr. Shah says he looked at Jim's health, which was otherwise excellent. He'd been exercising an hour a day for more than 50 years. He worked full-time, and Jim ate a pristine diet. And in Dr. Shah's book, all of these factors made Jim the perfect candidate for a new heart.
And we are thrilled to have Jim Wagner joining us this morning, along with his cardiologist, Dr. Zubair Shah. Thank you for being here. And Jim, Thank you for making time to join us. I understand you just got back from Ireland, so you must be feeling pretty good.
Feeling great. Yeah, we got back in August, had a great trip.
Yeah. And when it comes to how you were feeling, hearing your doctor say, how is he still alive? That's pretty jarring. How surprised were you when Dr. Shaw told you you need a new heart?
Obviously just shocked. I mean, I knew my disease had been diagnosed in the fall of 2018, and I had care at another facility, and they didn't tell me really how bad I was. So when we got down to KU to talk about the clinical trial, obviously it was a shock when I could tell Dr. Shaw was, I would say, a bit agitated, and we couldn't figure out why. And then we understood that he was frustrated that maybe someone else hadn't offered me a heart. And so we took off from there.
Well, thank goodness that you got in to see Dr. Shaw. Dr. Shaw, how would you explain to people watching what was wrong with Jim's heart?
Yeah, so Jim had what we call amyloidosis, and in his case it was related to age. We don't fully understand, but in some patients, they start building this protein on their heart with age, a protein called TTR protein or transthyretin protein. It becomes unstable, breaks down and builds on the heart. And in his case, it was age-related and had been going on for some time. And with that protein build-up, his heart cavity size was small. It had taken all of his heart cavity, and he was left with a very small heart cavity.
So it made his heart real thick.
Very thick and small cavity. Heart is a pump, and you need a tank. You need a tank. And in his case, that tank size was small.
So when it comes to age, thank goodness Jim and his wife could agree. Jim's age wasn't the main issue for you. So what do you look at when you're looking at who's a great candidate for a heart?
It's an excellent question, Alexis. So generally speaking, we don't have hard guidelines on age, but there is general consensus that 70 is a soft line, We don't look beyond 70 or offer transplants, but my philosophy is slightly different. I do look into the performance, the functional capacity, the goals, as someone has said, age is just a number. So same thing with Jim. He was from out of state, came to talk to me about the trial. And when I saw his echocardiogram, he had a CD, and I was surprised with that heart and thought he's not a trial candidate. We don't have time left. So I immediately started talking to him about his quality of life, his functional status, his goals.
Right.
And I was surprised. He still worked 8-10 hours a day. He exercised every day. Goals were aggressive. And if Jim remembers, I made him walk because I wanted to confirm. I said, Jim, can you walk for me? And I made him do a C. He did excellent. So I said, Jim, here is the deal. We need to look into transplant.
Right.
So I grabbed his hand, and he ended up in CICU same day.
That is such, it's a perfect thing to hear when we always hear our doctors say we look at the person, not the number, not the stats, the whole patient.
Exactly.
And I would argue Jim's in better shape than many 30 and 40-year-olds who will be watching right now, who's working out every day. I want to ask you, I mean, look at him. He's taken a break from work to talk to us, and he's probably worked out already. Have you worked out already today, Jim?
Oh, that'll come usually at noon.
Okay, your full hour?
I hit the Y every noon.
I love that. I want to talk to you, Dr. Shaw, about a study published in the American Geriatric Society. I found it super interesting. It says adults 70 and older have the same survival rate, the study says, after a heart transplant compared to patients all the way down to 18 years old. So that being said, why would other doctors, not you, but other doctors, see Jim's age as a red flag if a study indicates they have the same survival rates?
Alexis, you are right. I mean, studies have shown offering advanced therapies in older patients, outcomes can be same. Even we have published one on LVAD in elderly patients. But the trick is to select the right patients.
Right.
I think there's a confusion about that, and a lot of providers, a lot of advanced therapy programs just look at age and not look at that right elderly patient.
Right.
If they don't go beyond and look into functional status, quality of life, adherence, goals, and I think we should look into that. And seeing how Jim has done, I mean, our philosophy has changed also. We do look into elderly patients who are beyond 70 and do offer transplants. I mean, we have done, I think nationally we are one of the centers that's doing both LVADs and transplants, if not the highest numbers, but we are in top 3, I would say, offering VADs and transplants in patients who are above 70.
I want to give some information to our viewers. We have a QR code up on your screen. It has lots of information on our heart transplant team and the resources that are available to you, friends, family members. So you can scan that QR code throughout the program or after the live program while you're watching it and sharing it on a replay. And Jim, we have some amazing pictures of you. This is you, I believe we're going to show working out a year post-transplant and enjoying life post-transplant. But the thing is that this has always been part of your life. So what has your recovery been like as far as workouts? At what point did you get back to working out?
Well, I was fortunate. From start to finish, I was in the hospital 45 days. I got out of the hospital 8 days post-transplant. That night, my daughter lives in Kansas City. I grilled them salmon. And the next day, my son was in town from San Diego. We walked for 20 minutes. So I started right away. And I had a bike in my basement, and I walked a lot. But then I got on the bike, and then I was back in the Y by February and would have been there sooner except for COVID. So they encouraged me from day one to move. And I'm the kind of guy that if they say do 5, I'll do 10. And matter of fact, as Dr. Shaw said, they wanted me walking. Well, they kind of had to tell me to cool it a little bit. I was walking maybe a little too much. So.
Dr. Shaw, is it normal for a patient to be this active after a heart transplant, or is
generally not? Jim is one of the exceptions. Of the exceptions. Yes.
I bet you love patients like Jim.
Absolutely. I wish everyone would be as exemplary, as active, as him, and that also tells you how important baseline exertionals, how their baseline status is, how good they do post-transplant. He was discharged in 8 days after an open heart surgery, which is he was home in 8 days, and he was very functional.
I want to talk about nutrition as well, because Jim, you talked about grilling salmon for your family after this. When it comes to lifestyle, you and your wife and your whole family really enjoy what we call a pristine diet. And part of that is because what your daughter does for a living, right? Can you tell us a little bit?
That's correct. Well, my daughter actually got her PhD from KU in nutrition and dietetics. And so actually in 2011, my son got non-Hodgkin's lymphoma. And so she educated us on how important a good diet was. And so we actually got an apartment in San Diego and cooked most of his meals, made it mostly organic. And, so that they did the same thing for me. It's just dumb luck. My daughter lived 10 minutes from the hospital, and so they cooked a lot of my own meals and largely, organic, so that my immune system could do what it needed to do. So I do have a couple chinks in my armor, however. I'm not totally pristine.
Like, what's your go-to junk food? I have to know you're human. What's your junk food of choice?
I love to see the Schwann's ice cream truck drive.
Okay. So you are human. Schwann's ice cream will do it. I want to go to some questions from our viewers. We have quite a few of them. And Abby has a question about guidelines.
Yes.
Our viewer, Abby, she wants to know, are there formal guidelines that will tell you the age limits on heart transplants?
So as I said, guidelines are soft when it comes to age.
Okay.
There is no hard line on at what age we should stop offering. And Jim is an excellent example.
Who sets those soft guidelines or
so we
writes
have a
them?
transplant, the National Transplant Board, and they set up the guidelines. But then guidelines are institutional also. We have our internal guidelines, and we have been very open when it comes to age, especially in last 2-3 years.
Do you feel like that's changing because there are more people like Jim who are just exercising?
Yes, you are right.
Yeah.
You are right. And we have, and that is, I think, personally also, that's why they should stay soft. We should not have a hard age cutoff, because there are people like Jim who are active, who still will do what they are told. They're still functional, still work, and should be offered transplant.
Leslie wrote in. Leslie wants to know more about the clinical trial that Jim initially drove here from out of town with his wife to be in a clinical trial.
Yes.
So what was that about?
So Alexis, we are offering full slew of clinical, we are offering full treatment options as well as trials for amyloidosis patients.
Okay.
I think in Midwest, we may be the only center. Broadly speaking, there are two groups of treatments or two classes of drugs, stabilizers and silencers, for this type of amyloidosis. And Jim was very interested in silencer treatment. It kind of acts on the liver. It's a very latest technology, RNA-based treatment like COVID vaccine. So it kind of targets the liver and stops the protein synthesis. This is the protein that builds up in the heart. So thought process is, if we stop this protein synthesis in the liver, the buildup will stop. But keep in mind, it's for patients early stages. He already had buildup. It was too far. And rarely it can reverse, but we didn't have time to wait for that reversal.
And so
Jim was left with months, not years.
Right. So
and maybe weeks.
Oh my gosh, boy, that's so jarring to hear, because he has so much life in him that he wanted to live. I've got a question for Jim from Sarah. Sarah wants to know if the recovery was painful, and then she also wants to know, was Jim's wife nervous when he was doing all that exercising after his heart transplant?
My pain was amazingly, I believe Dr. Danter must have done a phenomenal job. After I, came out of the original sedation, I was never on anything but Tylenol. It was just incredible. Yeah, it was just incredible. So I guess you'd have to ask my wife, but it's just so much in my DNA that, and I was so encouraged by the doctors, to not sit around and to move. And so, I didn't do stupid things, but I kept moving and trying to get a little more every day. And so, it was incredible.
Bill wants to know, Jim, what were your initial symptoms? Because seems like this had really progressed. So what were you feeling, and what was life like for you by the time you got in to see Dr. Shaw?
Yeah, that's interesting, because I was diagnosed, as I said, in the fall of 2018, but I was largely asymptomatic. I was like, what are you talking about? There's nothing wrong with me. And then when we got down to KU, Dr. Shaw said, well, these things kind of go off the cliff. So in the summer of 2021, my workouts got very difficult. I would get dizzy, and I just couldn't go, or I'd get off and have to take a break. And in retrospect, and after coming down, I was in AFib, in and out of AFib.
Oh, okay.
And so my symptoms were dizziness.
So what was the test? This is a question from June for Dr. Shaw. What was the name of the test? Was it one test you did on Jim when he came in, when you said, whoa, how are you still alive? What was the name of that? And is that a test that anyone can request during a regular doctor's visit?
So generally, Alexis, the test for amyloidosis is a technetium pyrophosphate scan, PYP scan.
Okay.
And that diagnoses if patients have amyloid or not, this type of amyloid. But I looked at Jim's echocardiogram that showed me how thick the heart was and how small the cavity was.
And that's what you saw, and that
Yes.
hadn't been done anywhere else?
It was already done, but
Yeah.
for some reason, there was not much attention paid to those things,
And
unfortunately.
Wow, and so thank God you saw it.
Yes, we have a very strict, we are first of all very aggressive in amyloid patients.
Yeah.
Jim was diagnosed in 18, but not on treatment. We have started treatment.
Got it.
This is the medications for amyloidosis are relatively new, and we were pioneers in starting the treatments, even when they were not FDA approved. I have started in 17, 18 treating these patients when drugs were not officially in the market. We used to do compassionate use. I used to write letters to FDA to allow us to use the meds.
Because you knew it would work.
We knew, yes.
You knew it and you did it.
But unfortunately, Jim had not been on treatment for 3 years. Maybe it would have been a different story. But regardless, we are very aggressive. We treat all of our patients. We give them a chance. And we, at the same time, keep our mind open about transplant. It's a new field, transplanting amyloid patients, but we keep our options open in case they don't. We have a very strict protocol. There's a lot of research going on from our center about these patients.
Dr. Shah, I want to play something that Jim's wife Marlene said about you when we all first met you all. Let's
tell
listen.
Dr. Shah that he's Jim's guardian angel. And he told me at one point, don't say that anymore.
Okay, so Jim, you and your whole family developed this personal bond with Dr. Shah and the cardiac team here. So much so that your son-in-law donated a beautiful painting to the health system, and we have video of that presentation because the painting is now on display in the cardiac intensive care unit. Can you talk about the connection you have to Dr. Shah and your care team and the painting?
Well, I mean, I think Marlene hit it on the nail on the head. Thank goodness he saw this whole thing, and he saved my life. And what I'd say about it's not just, I mean, the cardiologist, I've said this before, but everybody at that hospital, everybody from the person that came in to inventory the equipment, to the people that brought the food in, to the nurses, to the doctors, everybody just treated me like $1 million. And it's just very humbling. I can't say enough things about the treatment I got there and the care I got there.
So Dr. Shah, you're the kind of guy that doesn't like a lot of attention, but we kind of have you stuck here. You're on TV and you're getting a lot of attention. You deserve it. What would be your final thoughts for our audience and seeing how wonderfully this turned out? That must just make your heart feel so full.
Yeah, first of all, Alexis, I do echo Jim's words. It's a team effort. I mean, I was a person who saw him there, have some expertise in amyloidosis, but you know, it needs a team effort for outcomes like this. So first of all, my team, especially our transplant director, Dr. Andrea Vidic, agreed to take the risk up front, believed in me. He has expertise in the field. And then surgeon, Dr. Denter, also agreed to take that risk. And I mean, I'm thankful to both of them also. And then the whole team, you know, the surgery went flawless, post-transplant management was excellent, and everyone played their role, as Jim said, the nurses, the anesthesiologists. So it's a team effort. We should always keep that in mind. We have a world-class team, and that's why we can perform like we did in Jim's case and do more of these high-risk cases.
Are you ready for just a little more attention? Because we've got another segment we love. It's the segment we love bringing you. It's called Behind the Mask. It's where we give you a peek at what our healthcare workers are like on a personal level. So we really wanted to get to know Dr. Shah a bit better. When he's not at the health system saving lives, he loves spending time with his #1 guy, his son. Okay, how old is your son and what's his name?
12 years old. His name is Sammy Shaw. He has a lot of energy. And with
Like his
me
dad?
aging, it's very tough to keep up with him.
So I understand you guys like to hit the pickleball courts?
That's right. That's right. We did a lot of pickleball this summer.
And who's better?
I think I'm.
Oh, you still think you're better? You're not going to throw
tries
any
to
games
play tricks
just
on
'cause he's
me.
your
Tries
son.
to place the ball. Knows I will not be fast enough. Other than that, I'm good.
You're showing him a thing or two. Do you think Sammy wants to be a doctor when he grows up?
I don't know about that.
He's too young to start asking.
We have not spoken about that.
He'll be smart like his dad. Well, thank you so much for joining us.
Thank you,
Jim.
Alexis.
Jim, you look great, and we are
Thank
so
you.
thrilled that you're here and that you made time to join us and you could share your story.